I once again request Dr. Singh for his presentation. We all know the bottlenecks of working in government sector. So let us see what Dr. Singh has to share with us.
Thank you, sir. Respected chairpersons, I'm thankful to Dada for giving me this opportunity to speak on this very important topic. So Dr. Dada has highlighted what is low vision. So low vision basically that we consider it as if it is less than 6 by 18, then we consider it low vision. If it is less than 360, then that comes under blindness category. So low vision is already defined. Uh, so low vision basically it is a chronic health problem. It affects the daily life of individuals such as driving, performing daily tasks, employment, and even mental health. And I am dealing with the help of Dr. Praveen Vasist and CBM in low vision services in our medical college. So low vision services has basically, it has three components. One is low vision assessment, which is very important. One should be trained in assessment of the low vision. Our optometrist and ophthalmologist should be trained how to examine a person with low vision, especially when it is pediatric age group, because we are encountering most of the low vision babies in our institutions. Then assistive device trial, which is also very important, which device suits to which patient, whether this device suits to the child or whether this device suits to the adults. Then the prescription of device. Prescription of device is also according to the trial, we basically prescribe the device. Then low vision devices, we all know that these are various category of low vision devices. It can be optical, non-optical, electronic devices, and some of the miscellaneous novel devices are there. But the basic principle is of all the devices is the magnification. So these are the few optical devices like microscopes, telescopes, magnifiers, field expansion prisms, and contact lenses. So these are the few non-optical devices which we will discuss in future also. And these are the assistive devices that can assist to a few of the patients. These assistive devices, when the optical and non-optical devices fails, then these assistive devices are also available to assist the low vision person in day-to-day activities. So we in our medical college, we opened the first low vision clinic of Punjab with the help of Dr. Praveen Vasist, All India Institute of Medical Sciences, and CBM. So in that we are basically uh, catering two vision centers, and from two vision centers we screen the persons with different eye ailments and also of low vision. And after that we refer on this referral slip to our institution, and then the trials are given to those patients, and after that we prescribe the low vision devices. Till date, with the help of the CBM, we are giving free devices to the uh, patients, especially the pediatric age group, which is my favorite subject. So then what are the challenges in government hospitals? So in our state in Punjab, there is availability of very few hospitals which are doing these low vision services. In the government sector, only our institute is doing low vision services, and there is none or less availability of assistive devices. So assistive devices are also not available in many of the districts. Even we are procuring those devices either from Delhi or from Calcutta. And lack of training on low vision rehabilitation services. This is a very important point, that there are few centers which are giving training to the low vision rehabilitation services. And also there is inadequate funding, and in most of the states the government is not funding on these low vision services. Government is funding on cataract, on keratoplasty, and diabetic retinopathy, etc. But government is not funding on this low vision rehabilitation services. So inadequate funding is there, and also non-acceptance to the devices. These devices, on first look, to the persons, they look little bit odd, you can say, as compared to the spectacles. So there is non-acceptance to the devices, especially in pediatric age group. The parents, they don't want to accept the bigger devices. So this is the most common cause of our failure of low vision services in pediatric age group, and also social stigma associated with the visual disabilities. When a child is wearing magnifying glasses, when the child is doing his or her work with the magnifying glasses, then the child feels that this is a stigma. So there is some mental block to the child is there. So although we are counseling the parents and the child repeatedly to overcome this stigma, but still this social stigma is still there, and transportation issues are there. Especially, I'm telling you that the low vision aids, those are not available in many of the states. Even we are procuring those from Calcutta or from Delhi. These issues are there. And in the government sector, in our institutions, so there is one, you can say, one block where UDID cards are there. Then disability certifications are, we are helping in disability certifications, we are helping in school admissions and jobs, and we continuously going to the schools and telling the teachers that this child is having low vision, but this child is a normal child. So you can little bit give more time as compared to the other children to this child. And we also tell the parents and the patients about the government schemes and concessions, which sometimes are not patient is not aware of. So this is what we are doing in our government institutions. Thank you very much for your patience.
Thank you, Dr. Singh. Uh, First half of your presentation reminded me of Professor Praveen's presentation at annual conference of Rajasthan chapter in Jodhpur. But second half, I think you have raised very vital issues in relation to the bottlenecks we are facing while working in government hospitals. And luckily we have Professor Praveen Vashish with us in our Equine. He's a very resourceful man. I'll request him personally and on behalf of everyone uh, in Equine to look into these gaps, use his vital, relations